We are Janssen Pharmaceuticals, a pharmaceutical company. We belong to the Johnson & Johnson group. And Johnson & Johnson has three sectors: a pharmaceutical sector, a consumer sector, and medical devices and diagnostic. So we are a company already founded in the 53. At Janssen Pharmaceutica, so far we are exploring the potentials of the technology of printed electronics. So we have never used it before. We are trying to see if it can be solutions for certain functionalities in healthcare. We can think about solutions in the environment of the patient, and we call it patient adherence. So how well does a patient stay on medication as it is prescribed by the physician, or how well does he stay on food or activities? We can think about the supply chain, cold supply chain, temperature monitoring. We can think about sensors, body sensors. So we see a lot of areas in the healthcare where the technology can be a part of a solution. It can be a body sensor maybe to measure temperature, to measure heart rate, but it can also be something else, like for instance glucose, or maybe even that we can sample tissue, blood, things like that. At the moment we are exploring, though that's one of my tasks. I have to explore new areas, new science and technology, and see if we can bring it to solutions for our needs. At the moment we are working internal, so we are exploring internal with our experts in the field. They have of course their relations with hospitals, physicians, healthcare practitioners. I see a lot of potential because at the moment, if you think about an integrated solution, you have many components. One of the elements is of course the cost. And we also know that cost in healthcare is also an issue. So if we bring solutions, we have to go for the maximum value we can bring for the money, for the patient. I think about the patient adherence. If people can stay on the medication, for instance by reminders or whatsoever, it's always better for the patient. So that's part of being a member of the association, is that we agreed amongst each other that we will set up a work group very specifically for healthcare. The first deliverable should be a roadmap of the technology components and the evolution to bring it to solutions. So that's the first part of the job. I think the most difficult issue is the acceptance of the health authorities for these solutions. They have to accept it if it is applied in healthcare. So I think that's the biggest issue. The other is finding the right people to work together, because I'm a believer that the solution will not be a one-component solution. It will be an integrated solution. So you need to find the right people around the table and willing to invest and to develop it. I think here you have a big network of people who are really in this field, in this technology. So, and I think it's the way to combine technology as an answer for certain needs, in this case for healthcare. These solutions can as well potential, certain of them, for instance, in the traditional consumer market, retail market, think about cold supply chain. So that's typically something which is not only healthcare, it can also apply in consumer, it can sometimes apply in the wellness sector. So yes, some of these solutions you can transfer them to other sectors. So I think we have to learn also step by step, and so that you have an acceptance as well from society to absorb these new technologies, typically for these kind of functionality. I'm responsible for the exploration of this technology, so we have to see if it has potential. Healthcare is always a huge market, and we have a lot of challenges. So I think from that perspective, yes, there is a market.